Bismillahirrahmanirrahim. Assalamu alaikum. Welcome everyone. In this presentation, we will explain local anesthetic toxicity during dental procedure. We will cover the importance of preventing toxicity and managing reactions if they occur. Understanding the contributing factors helps ensure patient safety during dental procedures. To prevent toxicity, it is crucial to use the minimum effective dose of local anesthetics. The dose should consider factors like age, lean body mass, liver function, and any history of issues with local anesthetics. The drug should be administered slowly, avoid intravascular injection. Vasoconstrictors should be used to slow the entry of anesthetics into the bloodstream. When applying anesthetics topically, be aware of the risk of rapid entry into the systemic circulation. The choice of anesthetic agent is also important considering factors like lipid solubility, vasodilatory properties, protein binding, and inherent toxicity. The clinical signs and symptoms of overdose or mild toxicity may cause increased confusion, talkativeness, anxiety, and slurring of speech. As the severity increases, look for stuttering speech, nystagmus, and generalized tremors. Slides 7 and 8 are for students who want to know about slurred and stutter speech. Severe toxicity can lead to headaches, dizziness, blurred vision, drowsiness, seizures, and cardiac issues. How to manage mild overdose reactions? Mild overdose reactions should be managed by monitoring vital signs and instructing the patients to hyperventilate. Administer oxygen if needed, and gain venous access for IV diazepam if signs do not rapidly disappear. Call for medical assistance if the symptoms do not improve. Regarding managing severe overdose reactions, if convulsions occur, protect the patient from self-harm. Use BLS measures as needed. And gain venous access for anticonvulsant administration. Diazepam should be titrated slowly until seizures stop. Check vital signs frequently and call for medical assistance. Let's go over the essential points once more. Proper use ensures safety in dentoalveolar surgery. Excessive amounts or improper administration can lead to toxicity. The prevention of toxicity reactions is achieved by adjusting the dose to individual patients' characteristics. Administer drugs slowly and carefully. Topical anesthetics can quickly enter systemic circulation. Knowledge of various local anesthetic agents is crucial for safe administration. Choose the right drug and amount to minimize risk. Overdose symptoms range from mild to severe. Recognize signs early to prevent progression. For mild overdose reactions, the initial management involves monitoring and supportive care. Diazepam can help control symptoms if they do not resolve quickly. Ensure patient safety during seizures. BLS and anticonvulsant are critical. Gain venous access. Administer diazepam, continuous monitoring, and medical support are essential. To conclude, preventing local anesthetic toxicity involves careful dosing, proper administration techniques, and choosing the right agent. Recognize the signs of toxicity and respond immediately to manage overdose reactions effectively. Ensuring patient safety during dental procedures is crucial. Thank you. Wish you best of luck.